So quickly trying to move to the next bone right here, which we'll be talking about its anatomy, and this is kind of like the upper part of the mouth, which is the maxilla. So I'm trying to talk about the anatomy of the maxilla, and so that I actually get to make a lot of sense out of it. So here, all this yellow part is what is known as the maxilla, you know. So they're actually what? Two bones. So one is on this side, one is on this side. So you could say that they're actually meeting in the middle. All right. So they're actually a pair of bone, and they form the upper jaw, and they play a very important role in how your face looks like. So they are actually one of the most important facial bones because they connect with what? Almost every facial bone. Outward, remember that they also push inside. Okay, we're talking about the face, we're not talking about the skull, we're talking about the face. Okay, so key features is it has a body, you know, it has the alveolar process, it has the palatine process, it has the frontal process, which will actually what interact with the frontal bone. Do you understand? Okay, it has a zygomatic process, which actually interacts with the zygomatic bone. All right, it has an infraorbital for ramming. Okay, so function is basically it forms the upper jaw and it supports the teeth that are up. So to contribute to the hard palate, to separate oral and the nasal cavities. So it helps to form the orbit and the nasal cavity. It houses the maxillary sinuses, which lighten the skull and the aid in resonance. So as you make sound, they also, you know, help to actually shape your sound so that you have the unique voice that you have. Clinical notes is the maxilla could be affected by cleft palates. You could also have fractures where you basically classify them as the left-foot fractures, type 1, type 2, type 3. Okay, then also maxillary sinusitis. Okay, maxillary sinusitis. So that's it, and we'll be back later on focusing on those clinical anatomy more in depth. Okay, we'll be back later on talking about them more in depth.